Hello, I'm Joy McKeith, co-founder of Triangle and co-author of the Outcome Star suite of tools. I'd like to introduce you to Triangle's report, Enabling Help. The Enabling Help report was published in September 2021, and we've been really bowled over by the response. And it's not just in the UK that it's resonated. It's been downloaded all over the world, in the US, Canada, Australia, Hong Kong, and many other countries. My sense is that there's a real appetite for new ideas and new ways of doing things. COVID showed us that we can make big changes and make them quickly when we understand the need. With this report, Triangle is making a contribution to the conversation about what needs to change and how. So on what basis are we making that contribution? Well, over the last 18 years, we've created 44 versions of the Outcome Star. Each one has been tailored to a particular kind of challenge, whether that be mental health, unemployment, being a carer, or any of the other issues you see on this slide. Each one has involved in-depth conversations with people with lived experience of those challenges and the people working directly with them. Each one has involved many rounds of piloting, psychometric testing, feedback, drafting, and redrafting. The most visible product of all that work has been the outcome stars themselves, but there's been another less visible byproduct, and that's a lot of learning about what works when supporting people to move towards greater choice, independence, and well-being, especially people facing chronic and complex challenges. And alongside that, each year Triangle runs around 300 courses on the Outcome Star for frontline workers. And we also support around 300 in-house STAR trainers and offer ongoing support to the roughly 1,000 organisations using the STAR at any given time. In doing this work, we've also learned a lot about what gets in the way of effective help. So this talk will be in 3 parts. First of all, I want to share with you that learning about what works. Then in part 2, I'll share our experience and our analysis about what's getting in the way. And then finally, in part 3, I'll paint a picture of how things could work better. So, what have we learned about what works? Whether we're talking to people in mental health, employment, homelessness, or youth or other services, there are certain themes which come through again and again. The kind of help that really makes a difference when people are dealing with complex and ongoing challenges is help which enables. We've drawn out 6 principles of enabling help. It's help that's relational, built on trusting, empathic, and reliable relationships. It's help that's motivational, building hope, focusing on strengths and achievements, and developing a sense of personal agency. It's help that's developmental, that builds skills and capacities and provides opportunities to learn. It's flexible help that's tailored to each person, their particular capacity, their preferences, what matters to them. It's holistic help that looks at the whole picture and joins the dots, not just the presenting problem. And finally, it's help that's contextual, that recognises the impact of poverty, discrimination, trauma, and lack of opportunity. This framing is new, but the ideas are unlikely to be a surprise. It's very consistent with the principles of strengths-based and trauma-informed work, and with the person-centred approaches which policy documents from government and service providers have been talking about for decades now. Our intention as a sector is clearly to work in this way. But Triangle's experience of training and supporting organisations to use the Outcome Star is that this is often not the reality on the ground. It can feel like we're pushing a boulder up a hill. With a star, we're training and supporting people to work in an enabling way. But the context in which they're working doesn't support this. So what's getting in the way? Clearly, a key factor is cuts to public spending, which have really squeezed services and forced them to reduce the time they spend with people and focus on the most acute need. However, we believe that there are also other factors at play, and that's what I'm going to look at in the second part of this talk. So what are these other factors? Well, first, the bad news. The problem, in my view, runs deep. We're not looking at some superficial tweaks, a new government programme here, a pot of funding there. These things all have their place, but this problem runs a lot deeper than that. We think it's the ideas, the mental models informing our ways of commissioning and delivering services that are getting in the way. It's as fundamental as that. But now for the good news. We can change our mental models, and we can change them in an instant, without funding, without restructuring, without new roles, without permission from anyone else. Of course, once we've made the changes to our mental models, we'll need to do things differently, and that will involve all sorts of challenges. But the first step, at least, is doable now and is in our power. We've identified 4 different sets of ideas or paradigms that have in the past or are now shaping how we do social provision. First of all, at the front line, we've borrowed ideas from medicine. I'm calling this the medical paradigm. In medicine, the person being helped is a patient. The core assumption is that they're sick or flawed in some way, and the person helping them has the expertise to diagnose what's wrong and prescribe the treatment that will address the problem. When someone says, these people can't change, rather than looking at what is changing, even if those changes are small, or when someone talks about lack of compliance, rather than exploring the reasons behind the behaviour, that's the medical paradigm at work. This framing is largely historical. It's widely recognised now that the medical model isn't helpful in social provision. But our experience is that, although the thinking has changed, the legacy of this approach is still very much there. This is partly because change takes time. It's also because it's difficult for services to implement a different approach when frontline workers have very limited time with people and don't have the training and support needed to work in an enabling way. It's difficult to be relational and developmental, for example, when you're only allowed to have 6 sessions with someone. Moving on to the management of services, we've leaned heavily here on the principles of bureaucracy. The core assumption here is that fairness, accountability, and the management of risk are best served through an impersonal system that provides a standard service delivered in the same way to everyone. This is the bureaucratic paradigm. When someone enforces a rule in a way that doesn't acknowledge the impact on the person, or feels they must stick to the letter of the rules, despite knowing it isn't the right thing for that person, but they're scared of what might happen if they don't, that's the bureaucratic paradigm at work. There's increasing recognition that fairness isn't served by sameness, and that services need to be human and empathic, as well as fair and transparent, and that services need to flex to the person rather than the other way around. But when things go wrong, there's a tendency to try and eliminate risk by tightening procedures and pinning things down more and more. And when workers are pressured and there isn't enough time, they inevitably focus on the minimum. And that means managing risk rather than digging deeper into causes and solutions. Moving on now to the planning and commissioning of services. Here we've borrowed from economics. The core assumption is that the tools of the market, financial incentives and competition, are the best way to maximise effectiveness and efficiency. This is the economic paradigm. Payment by results is an expression of this paradigm, and so is asking service providers to compete for service contracts. There have been real wins here. For example, personal budgets for people with disabilities have given them control over their support, and these ideas have helped to focus thinking on outcomes rather than processes. But there are conceptual and practical issues with this approach. I'm going to spend a bit longer on this one because it's the dominant paradigm at the moment. So first of all, the conceptual issues. It assumes that providers are in control of results, whereas in fact, outcomes are the result of many factors, not all of them in the provider's control. It also assumes that a positive result can be defined independent of context, but an outcome that is positive in one context can be negative in another. For example, keeping a child out of care can be positive if the home environment has improved and the child is safe, but negative if it hasn't improved. And finding a permanent tenancy for somebody can be positive if they have the skills, resources, and support to maintain that tenancy. But if they don't, and they're back on the streets 3 months later, then it isn't necessarily positive. It could just contribute to a sense of, it'll never work out for me. So then there are the practical issues. The first and very well documented one is that when service providers are held accountable for targets, they prioritize achieving the target. And sometimes that isn't the thing that's most important or most appropriate for the person being helped. Another practical issue is that we found that when service providers have to measure outcomes for reporting, they don't engage with the potential of outcomes to drive learning and service improvement. And management attention moves away from enabling effective service delivery and on to measuring and reporting. And finally, the retendering and switching between providers that's part of this approach can be costly in terms of commissioner and service provider time and disrupts collaborative working between service providers. All in all, there are lots of reasons why these ideas can be more of a hindrance than a help. So finally, looking at research and policy making, here we've borrowed ideas from the natural sciences, subjects like physics and chemistry. We look for a formula that says, if I give this kind of help to this kind of person, then I'll get this kind of outcome. I'm calling this the natural sciences paradigm. The core assumption is that what works can be pinned down to a service formula and defined independently of context. But people and communities are more complicated than that. And I think that's why pilots can often succeed, but the results can be disappointing when the pilot is scaled up. It wasn't that particular formula that worked. It was perhaps the way it fitted the context or the skills and commitment with which it was implemented. Randomized control trials are an expression of the natural sciences paradigm. This is not to say that they can't be helpful in social provision, but they can simplify research questions too much to something like, does it work? Often in a complex environment, it's best to ask more open questions like, what was it that made it work? So here's a summary of the 4 paradigms. We have the medical paradigm, in which the focus is on the helper. The person being helped is a patient. The service is a treatment. There's the bureaucratic paradigm, which focuses on the organisation providing the service. The person being helped is a recipient, and the service is a process that they go through. There's the market paradigm, which focuses on the commissioner. The person being helped is a consumer, and the service a product. And finally, the natural sciences paradigm, which puts the focus on the intervention. The person being helped is a subject, the service is a formula. My core point here is that although these ideas may work well in the fields from which they're borrowed, the core assumption on which they're based are flawed when applied to complex human challenges. The motivations behind applying these ideas are good, and they may have value in some circumstances, but they're not a suitable foundation on which to build. And to mix my metaphors, they can steer the service delivery system off course. And what's more, we don't need to borrow ideas from other fields. We know what works in service delivery. Enabling help is what works. We know what works, but what we haven't cracked yet is how to create service delivery systems which can deliver this kind of help at the front line, not just here and there in exceptional services, but everywhere. Which leads me to part 3, how things could work better. Here's my central proposition. Outcomes are achieved through relational, developmental, flexible, holistic work at the front line. They're not delivered by contracts, even if they're outcomes based. They're not delivered by research. They're not delivered by record keeping and outcome monitoring systems. They're not delivered by presentations like this. All these things can help, but only if they support this kind of work at the front line. If they make it more difficult or take attention or resources away from it unnecessarily, then they're part of the problem rather than part of the solution. The service system must serve the front line, not the other way round. The job of everybody in service delivery system who is not working at the front line is to make enabling help at the front line possible. Their job is enabling help. So what does this look like? An enabling approach to management means focusing on facilitating the delivery of enabling help at the front line. Of course, we still need rules, reporting, and procedures, but these shouldn't be the focus. The key task for managers is to enable staff to take the initiative and solve problems in order to help service users rise to the challenges they're facing. The enabling manager asks, what's working with this person and what's getting in the way? They encourage reflective practice. They recognise that part of their role is to nurture staff resilience and capacity, because that translates into a more skilled workforce who are better equipped to enable the outcomes that we all want. An enabling approach to commissioning means focusing on shared values and goals, building a strong collaborative relationship with service providers, and supporting collaboration between service providers too. It still means holding service providers to account, but it's more productive to hold them to account for learning than it is to hold them to account for achieving a particular target. The enabling commissioner asks, what sense have you made of this data? What have you learned and what are you doing differently? Rather than, have you achieved the target? The trouble with holding people accountable for targets is that it doesn't on its own improve outcomes, whereas learning from measurement points the way for change and improvement. Finally, an enabling approach to policy making and research means asking, how can we create responsive learning service delivery systems that consistently deliver enabling help, rather than trying to find particular intervention formula that always work? Trying to pin down what works in this way is like trying to work out the perfect way to parent a child. It's very hard to identify a particular set of behaviours that always work. Good parents are loving, resilient, and flexible. They adapt as things change. They make mistakes, but they learn from them. It's the same when it comes to social provision. I don't want to imply that any of this is easy. There are no magic bullets here. It takes time, vision, and persistence to create an enabling service delivery system. It's more like tending a garden than lighting a firework. It's slow, patient work but over time, the effort is rewarded. I'm sure some of you already work in this way or try to, but because it isn't easy to quantify or codify, it can be invisible and it can be taken for granted or crushed by more conspicuous but shorter term approaches. That's why it's so important to name it, to make it visible and to value it. This way of working offers fewer certainties than some other approaches and demands more of people delivering services, but it's potentially a much more exciting and rewarding context for us all to work in. Most importantly, it has the potential to transform services, systems, and lives. So please read and share this report and the video. Talk about it on social media and in person. And we'd love to hear your feedback and experiences. So please get in touch, especially if you're a manager, leader, commissioner, or policymaker who's doing things differently or wants to. It's time for the ideas driving social provision to change. And it isn't just us who's saying this. With this report, we're adding our voice to a growing movement. Here are just some of the other organisations and authors making a similar case. My hope is that you will join us.